125. Myself Srija. So today in this session you are going to learn about the ICD-10 classification from code ranges I-80 to I-99. So what does these codes describe? So coming to ICD-10 code ranges I-80 to I-89. So what's included in this? The diseases of veins, lymphatic vessels and also the lymph nodes. So this code covers the problems of the veins and lymphatic system. So this block includes thrombophlebitis. So what do you mean by thrombophlebitis? It's a inflammation of vein clot. So you have to assign the code I-80. So next phlebitis. Phlebitis is nothing but inflammation of a vein without a clot. You have to assign the code I-80. So next deep vein thrombosis. It's DVT. So you have to assign a code I-82 for deep vein thrombosis. Nothing but a blood clot is formed in the deep vein, usually in the leg. So this can lead to the pulmonary embolism if clot travels to the lungs. And then varicose veins, I-83. Varicose veins, these are enlarged, twisted, bulging veins, usually in the legs. So next, hemorrhoids. So hemorrhoids are these are found in swollen veins in the rectum or anus. So these hemorrhoids, they can be internal or external. So lymphangitis. Lymphangitis is nothing but it's an infection or inflammation of the lymphatic vessels. So this is often present as a red streaks on the skin. So lymphangitis is assigned by the code I-89. So next coming to lymphedema. Lymphedema is I-89.0. So you can see the swelling caused by blocked lymphatic drainage. So this is common after the cancer surgery or the radiation. A fluid collects in the tissue. It's a swollen arm or the leg. And then lymphadenitis. It is assigned the code I-88. So in this you can see a inflamed lymph nodes, usually due to infection. So what is the example of lymphadenitis? It is a swollen tender nodes in neck during the infection. So you can also find the other disease named non-infectious lymph disorder. So what do you mean by non-infectious lymph disorders? So this type of disorders, it includes congenital lymph problems. They can also include the lymphatic obstruction and also the lipedema. So here you can clearly find the pictures of the thrombophlebitis and also the lymphedema. So now let's talk in detail about these code classification. So coming to I-80, what it is, it's a phlebitis and thrombophlebitis. So phlebitis is nothing but it's an inflammation of a vein, means a no clot. So thrombophlebitis means thrombo is nothing but it's a clot. So it's a combination of a clot plus inflammation. So this can occur in both the superficial veins or the deep veins. So what is the subcode of phlebitis and thrombophlebitis? I-80.0. It describes the phlebitis and thrombophlebitis of the superficial vessels of the lower extremities. So superficial veins means the veins which are just under the skin. So what is the common superficial veins of the legs? They may be a great saphenous vein and also a small saphenous vein. So what is the example? If a patient has a painful swollen red line along the superficial leg vein, then you have to assign the code I-80.01. This is about the I-80 code. So next coming to I-81 code. What does it describe? A portal vein thrombosis. So what do you mean by portal vein thrombosis? When the portal vein carries blood from the intestines to the liver, a clot here blocks this blood flow. So this results in the portal vein thrombosis. So where do we see it? You can see it in the liver disease. You can see it as a cancer and you can see also an abdominal infection. So what is the example? A portal vein thrombosis seen on abdominal CT. So in this case, you have to assign the code I-81. At the right side, you can clearly see the picture of the portal vein thrombosis. So this shows a blood clot. You can see a blood clot over here, right? So you can see a blood clot and it also shows a normal liver. This is a healthy liver and this is a liver with this cirrhosis. So you can clearly see the inflammation. This is a common cause. So next coming to I-82 code. So what does it describe? other venous embolism and thrombosis. So this is a big category covering many other veins. So they include clots in upper limbs, pelvic veins, inferior vena cava, and DVT not covered under I-80, and also the embolisms. So embolism is nothing but it's a clot travels from one vein to another. So what is the example of this condition? It's a upper limb DVT, pelvic DVT, vena cava thrombosis. So everything, these all the diseases are which are coded under the I-82. So you have to assign the code I-82 for the whether a vena cava thrombus is diagnosed or the embolism of the veins is diagnosed. So next coming to I-83 code. So the range IC10 cm from I-83 to I-85, these include about the varicose veins. These include all the diseases including the varicose veins and also the hemorrhoids. So what does I-83 code describe? Varicose veins of the lower extremities. So varicose veins are nothing but these are the swollen twisted veins in the legs due to weak walls. So they may present with the pain, edema, inflammation, ulcer and ulcer with inflammation. So what is the subcode? I-83.1. So whenever a varicose veins with inflammation is diagnosed in the record, you have to assign the code I-83.1. So inflammation is nothing but how do you see the inflammation? How do you see? It is redness in color. It is red in color. You can see the redness. You can feel the pain and also you can feel the warmth. So when a patient has red painful swelling along the varicose veins, you have to assign the code I-83.11. So this is about the varicose veins. So next coming to I-84. I-84 are nothing but hemorrhoids. So what are hemorrhoids? These are the swollen veins around the anus or rectum. So there are three types of hemorrhoids. These are internal, external and combined. So internal hemorrhoids, these are present inside the rectum. External hemorrhoids, these are present outside the rectum. So these are painful. And whereas combined, so combination of the internal and external is the combined form of the hemorrhoids. So I-84.1 is a subcode of I-84. It describes the internal thrombosed hemorrhoids. Internal thrombosed hemorrhoids. So what do you mean by the word thrombosed? Thrombo is the clot, right? So a clot forms inside the hemorrhoid is a thrombosed hemorrhoid. So this causes a severe pain. In the right side, you can see a thrombosed hemorrhoid picture. So these are the external hemorrhoids. These are the internal hemorrhoids. So external hemorrhoids, these are present outside the anal opening. Whereas internal, these are present one as a dark clot. So it is thrombosed. And next, esophageal varices. I-85. The I-85 code is assigned for esophageal varices. So what do you mean by esophageal varices? How do you define it? Esophageal varices are nothing but these are the dilated veins. Dilated are swollen. So these veins are swollen. So these are the swollen veins in the esophagus, usually due to a liver cirrhosis. Liver cirrhosis means what is the condition resulting in the liver cirrhosis? If there is an increased blood pressure in the portal vein, it leads to portal hypertension. Nothing but it's a liver cirrhosis. So these are very dangerous because they can burst. So esophageal varices, these are very dangerous because they can burst. So they have the capability of bursting. So what is the subcode for esophageal varices? I-85.0. Esophageal varices with bleeding. So whenever the swollen veins burst, you can find the massive bleeding, right? Yeah. So esophageal varices with bleeding, whenever it is diagnosed, you have to assign the code I-85.0. So for example, when a patient with liver cirrhosis is vomiting the blood, so this condition results in the hematomesis. So what you have to code? You have to code I-85.0. You can see a picture of esophageal varices. You can see a swollen, you can see here a swollen balloon-like veins inside the esophagus. So this can rupture and this can cause the bleeding. It results in the bursting and it leads to the bleeding. So I-86 is for varicose veins of other sides. So these are the varicose veins which are not in the legs. For example, variocele. So what is varicocele? It is a swollen, enlarged veins around the testicles. You have to assign the code I-86.1. So next coming to I-87. This is other disorders of the veins. So this category includes various conditions that affect veins but not the varicose veins. So for example, I-87.0, it is a post-thrombotic syndrome. So this syndrome, it happens after a previous DVT. So why? If a clot damages the walls, the blood cannot move upward. So this results in pooling and then it results into the swelling. So what are the symptoms of I-87.0? Chronic leg swelling, pain, inflammation, skin discoloration, and also the venous ulcers. So what is the example? A chronic leg swelling plus if you have a past history of DVT. So what you have to assign? You have to assign the code I-87.013. In the picture, you can clearly see a normal vein and damaged vein differences. In normal vein, the blood flows towards upward direction. You can clearly see the arrows in the upward direction. Whereas in damaged vein, you can see the walls fail back. It results in backflow and it results in the swelling and pain. So next, I-88 code for non-infectious lymphadenitis. I already said you, what do you mean by lymphadenitis? It's an inflammation of the lymph node. So swelling or inflammation of the lymph node, you can clearly see in the picture over here. Here the lymph nodes got enlarged or swollen. So this is mainly common in the children. So it is often seen with the abdominal pain. And then I-89.0, the other non-infectious disorders of lymphatic vessels and lymph nodes. So this covers the lymph problems that are not caused by infection, such as the lymph drainage issues. So lymphedema, it is a swelling caused by blockage of lymph flow. So what is the example? A chronic swelling of arm after the mastectomy. So surgery removes the lymph nodes. It results in the lymph fluid can't drain over and this results in the swelling of the arm, giving you the pain. So next, the ICD-10 code ranges for I-95 to I-99. What does they describe? Other and unspecified circulatory system disorders. So these codes cover circulatory problems that don't fit into the earlier categories like heart disease, stroke or vascular diseases. So next, let's talk about I-95. So what does it describe? Hypotension. So what is hypotension? It's a blood pressure which is too low to supply organs properly. So what are the common symptoms of the low blood pressure? You can see here in the picture, dizziness, fainting or passing out, upset stomach, blurred or distorted vision, fast or shallow breathing, fatigue or weakness, feeling tired, confusion, and also you can see the symptom like agitation. So these are all the symptoms of the low blood pressure, nothing but the hypotension. So I-95.0, it is the idiopathic hypotension. So what is idiopathic? I already said you, idiopathic means no known cause. So this person has a chronic low BP, but no disease or no reason is found. For example, if a healthy woman with chronic low BP is diagnosed, you have to assign the code I-95.0. So this is about the hypotension. So next coming to I-96, what it is? It's a gangrene, not elsewhere classified. So this code is used for gangrene. So when the cause is not specified or if it does not fit the other categories. So you should not use I-96 if gangrene is due to diabetes. If gangrene is due to diabetes, you have to use E10 to E14 category codes. So gangrene is due to a peripheral artery disease, you have to use this I-70.X. So you have to use I-96 only when the cause is unclear, only when the cause doesn't fit any other code. For example, unspecified foot gangrene without PAD, without peripheral artery disease documentation is done. So then only you have to assign the code I-96. And then I-97, it's a post-procedural disorders of the circulatory system. So these codes, they are used for the complications that happen after a heart or blood vessel surgery. So what are the examples of the procedures that may lead to I-97 conditions? It is CABG, bypass surgery, it is wall replacement, any heart surgery, or any major vascular surgery. So what is the subcode? I-97.0. What does it describe? It describes post-cardiotomy syndrome. Post-cardiotomy is nothing but it's a after heart surgery. Post means after, right? So after heart surgery. So this condition, it is the inflammation of the pericardium. So it happens only after the open heart surgery. So what will be the symptoms here? It may be a fever, chest pain, and also you can see a fluid around the heart. For example, when a person is diagnosed, he develops fever plus chest pain after a open heart surgery. So which code you have to assign over there? You have to assign the code I-97.0. So this is a post-surgery pericardial inflammation. I-97.0 nothing but it's a post-surgery pericardial inflammation. So then this next coming to I-98. So what is I-98? Circulatory disorders in diseases classified elsewhere. So this code is used when a circulatory problem happens because of the another disease. Nothing but its secondary condition. So first you have to code the underlying disease, then followed by I-98. So what is the example? It's a circulatory collapse due to severe infection. So here, what is the underlying cause? The infection. Maybe for example, sepsis. So what is the secondary circulatory collapse? It is I-98. So in this way, you have to assign the code for I-98 category. So next coming to I-99. What does it describe? Other and unspecified disorders of circulatory system. So what is I-99? It is used as a leftover code or catch-all code. So you have to use it when the circulatory condition does not fit into any other category from I-00 to I-98. So the doctor has not provided enough details to code more specifically. So in that case, you have to code I-99. So circulatory problem but not enough info to classify it properly. For example, I-99.0. It's a rheumatic heart disease unspecified. So this code, it is used when the doctor says rheumatic heart disease but does not mention which valve is affected, whether a mitral valve, whether a aortic valve, whether a tricuspid valve or a pulmonary valve. So there will be no details of regurgitation, stenosis or other complications are provided. So we know there is a rheumatic heart disease, but there are not enough details to choose a specific code like I-05 or I-06, etc. So in this case, you have to assign the code I-99.0. So this is the picture of the rheumatic heart disease. You can clearly see a stenosis narrowing and regurgitation nothing but the backward flow of the blood. So this is about the classification of diseases for the circulatory system from categories I-00 to I-99. This is for today's session, guys. In the next session, you are going to learn the anatomy and physiology of one more body system. Thank you.